Good morning, everyone. Good morning. Thank you all for being here with us today. My name is Mark Drayson. I'm the Executive Director of the Metropolitan Area Planning Council, which is the regional planning agency for Greater Boston. We serve most of the communities inside the I-495 belt, but a lot of our policy work is statewide or even on the federal level. And over the course of the pandemic, we have witnessed, along with so many of you, the disproportionate impact of the pandemic and the recession on women in our society, women in the workforce, and particularly women of color. We have seen not only remarkably large job losses for women, far in excess of men, but larger disparities in job losses, particularly for Black and Latinx workers. We have seen drops in labor force participation that have been the highest for those who lack a means of paying for expensive childcare, and for folks who have challenges re-entering the labor force after dropping out. And we have also seen particularly high layoffs in the public sector. In fact, recent job loss data from the federal government indicated that while all of our other sectors were recovering, public sector layoffs continue. And those tend to have a disproportionate impact, particularly because women have done reasonably well over the years in government employment, and also particularly Black women in local government. And so when we see disproportionate layoffs in the public sector, it is very logical to assume that it will affect women, and it will affect particularly Black and Latinx women, even more so than layoffs in some parts of the private sector. All of these impacts have a tremendous force in terms of our ability to have an equitable recovery. We're at a somewhat more hopeful moment, despite the fact that we've seen infection rates go up over the course of the last couple of weeks. The overall hope is that as more people get vaccinated, we will begin to put the pandemic somewhat in the rearview mirror. The economy will open, people will go back to work, folks will have the means to dig out of the holes that they've been in, both socially with isolation and also economically, that have affected so many folks. But we are not going to succeed in that effort if we allow the disparities that we saw based on gender and based on race in the course of the pandemic to remain in force and just get a little less worse. That's not going to be good enough. We're going to have to find ways of making sure that we pay special attention to the folks that have been hit hardest by this pandemic and recession, and that includes women, and particularly women of color. And for that reason, I'm very excited that we have 4 people joining us today who are leaders in their fields and who are going to speak to us about what challenges they have seen in the course of the pandemic, and also begin to give us some hints and ideas and suggestions and maybe a little bit of inspiration for what the future will look like as we try and move out of this recession and pandemic and develop a recovery that can be equitable for all in our Commonwealth. We are very pleased to have with us Senator Karen Spilka, Leslie Forde, a businesswoman from Brookline who is representing BACMA, Tanisha Sullivan, the local president of the NAACP, and Saskia Evans from PNC Bank, who is also a moving force behind the new Early Childhood Education Coalition that has been established in Massachusetts. And I know that all of them are going to have fascinating and impactful suggestions for us as we look toward a more equitable recovery in the future. We are going to start out with the Senate President. Everyone's going to give opening remarks, and then we're going to have a panel discussion, which will include the opportunity for questions from the audience. And to lead us through this effort, I am going to turn it over to our director, our co-director of strategic initiatives, who also runs our sub-regional program and our community engagement efforts, Emily Torres-Cullinane. Before I do so, I want to thank several members of my staff, a number of whom are on the screen today. Our Deputy Director, Rebecca Davis, Lizzie Wayant, who runs government affairs at MAPC, Elise Harmon from our communications staff, Betsy Cowan, who could not be with us today, but who runs our economic development effort, and most particularly Sasha Perotti, who helped me to organize the event this morning. and has done a tremendous amount of behind the scenes work to make sure that this is a successful event. With that, and thanking our speakers, I'm going to turn it over to Emily.
Good morning, everyone. It is really an honor to be with such a group of distinguished women. And so I will just sort of lay out an opening question for you all. As Mark had mentioned, the pandemic has laid bare many long-standing challenges facing women in the workforce, and especially women of color. In your view, what are some of the most critical challenges, and how can business and government respond? And so I will go ahead and allow first, Madam President, if you could share some comments with us.
Okay, thanks so much. And I want to thank Mark and you, Emily, and the whole team at NAACP for gathering us all here today on this very important issue, and an issue that has become more and more stark as time goes on. First of all, happy April Fools to everybody. It's a little ironic to have such a serious issue on April Fools, but you know, it's always good to acknowledge some levity. I'd like to start out by saying that I was struck by a recent op-ed in the Globe that shared the following statistic. Before the pandemic, women in Massachusetts were participating in the workforce at increasing rates, surpassing the national average rate by 2019. We had surpassed the national average. Unfortunately, COVID-19 brought them back to where they were at the end of the Great Recession in 2009. And this literally took my breath away. A decade of progress, a full decade of progress built on what has been for so many women a lifetime of progress, is gone, wiped out in the space of 1 year. That is amazing to me. We need to immediately advocate for policies and programs that will help women, especially women of color, stay in the workforce. I immediately started advocating for more attention to be paid to childcare. It's, I believe, an essential part of the infrastructure, just like whether it be transportation or anything else that is absolutely necessary for people, for women to get back to work. But I do believe that we need to rethink childcare, how we pay for it. We pay generally per head, per child. That's not a good model that has come to light, because many childcare centers have closed because of that and would not be able to reopen. We need to expand our childcare. We need to rethink the funding model, what we pay our childcare providers, their staff, the people that work there. We need to look, and that is why, you know, the Senate is committed to reforming childcare over time, where it's located. If people aren't dropping their children off at their work location because they're working from home, maybe we need to look at spreading it out more across the state in other areas, different hours, flexible hours. And I believe that the timing is perfect. I've been to recently Framingham Y that had some terrific childcare there. They pivoted soon after COVID, particularly for our essential workers. And it highlighted the need of childcare, talking to parents as well. I was there with Senator Elizabeth Warren, Congresswoman Clark, and they have gotten money, and Massachusetts will be getting a lot of money for childcare. So this opportunity between that and the funds that the state have put in, I am committed to reforming our early education and childcare. We also pushed for emergency paid leave for women, particularly if they needed to quarantine as they were working, or they were sick or needed to care for somebody in their family. I was able to get that through, and actually the bill is still on the governor's desk. So that would provide at least 5 days of emergency paid leave, particularly for women, because we know caring for the family still falls more on women. The pandemic brought to light the burdens women face as caretakers. Not only are they key to our economy, but they also care for our children, our family members, and the elders in our families. It's clear that women in the workplace benefit from flexibility, the use of technology to work remotely, and paid time off to care for themselves and their family members. And we can all play a part in advocating for these workplace policies. We need to ensure that the state government, federal government, businesses do everything that we can together to ensure that women return to work, whether it be training and retraining opportunities. We need to make sure that we as a state utilize all of the skills, the fantastic skills that women have. Otherwise, bottom line, we will not have a full and equitable recovery. I just want to end by saying, in a cultural sense, we also must start insisting that men take on more of the caretaking roles. We've come a ways over the last few decades, but not as much. I believe that this last year has also laid bare, it still falls mostly on us women. We need to make sure that we have policies in place that support single working mothers and working parents who can't afford to have one person leave the workplace, because that, in fact, is the reality for so many families. Thank you.
Thank you for your comments and for your leadership, Madam President. I would also like to recognize your colleagues and their leadership as well, Senator Lovely, Representative Socolo. I do believe we have some mayors and town managers as well on the line. So thank you for all the municipal leadership that could attend and also leads this work. I think the Mayor of Gloucester has joined us, and Mayor Thecken. Thank you so much. All right, so we're going to move on to our next speaker, Tanisha Sullivan, President of the National Association for the Advancement of Colored People from the Boston branch. And I know policy is one of her favorite words in this arena as well. So go ahead, thank you.
Absolutely. Thank you so much, Emily. And thank you, Mark, Sasha, and really the entire MAPC team for convening this very important conversation. For those who do not know, the NAACP is really the oldest civil rights organization in the country with a mission specifically focused on the elimination of racial discrimination. And what we know in our work is that the advancement of racial equality is inextricably linked to gender equality in our country. We are very proud here in Boston, fun fact for you, that the very first woman president in the NAACP actually was from right here in Boston, Florence LeSueur. So that is a legacy that I'm very proud to carry forward. On this particular topic, there can really be no question with respect to the deep socioeconomic, racial, and gender disparities that the COVID-19 pandemic has laid bare. As many have opined, the pandemic did not create the disparities. The pandemic simply amplified the consequences of years, I would say generations, of society's failure to adequately address antiquated systems and to revisit regressive public policy that is antithetical to our value of equality. In addition to the yet unknown long-term health impacts of the virus, we must also face the social, emotional, mental health implications of the past year, and the reality that for as resilient as we say our children are, they too are human, and our actions today will indeed have the most significant impact on them tomorrow. But as we engage in today's conversation and center the impact of this virus on women in the workplace, I do believe that we must continue to sound the alarm. The advancements of women in the workplace over the past several decades are the result of hard-fought battles. We as women, we have the scars to prove it. Our success over the years has meant beating back stereotypes about our leadership style, our personal life choices relative to home, our appearance, and all of that is before we get to the questions about our competence to do and perform any specific job. Yet we have been relentless in our fight for equality in the workplace, and we were winning pre-COVID. I do believe that we will continue post-COVID to see progress. However, there is much more work to do. We know that numerous studies and reports over the past few years have amplified the value of gender diversity in the workplace, namely those, I'm sure many of you have read them. Catalyst and McKinsey have, I think, just done a fantastic job nationally of just keeping pace with this particular issue and keeping it really front and center for the business community and public policy makers alike. But we know that this pandemic has hit all of us very hard. You know, I frequently say that the virus does not discriminate, but it surely impacts all of us differently. In the racial equity context, we know that the devastating impact of this virus on Black and Brown communities specifically, and looking at this virus through a gender equity lens, it is undeniable the impact, the disproportionate impact that this virus has had on women. And so it is true, again, the virus does not discriminate, but its impact its disproportionate impact cannot be denied and cannot be ignored. The pandemic has reminded us in many respects just how fragile our progress in the fight for women's rights, access, and opportunity actually is. That's present state. The fight actually is. And for BIPOC women and those who are victims of poverty, this reminder has hit with devastating consequences. The 2020 Women in the Workplace Workforce Report from McKinsey found that the COVID-19 pandemic has had a devastating impact on women, and their research found that we can expect nearly close to 2 million women to contemplate an exit from the workforce. The report also showed that women of color specifically were more likely to be laid off or furloughed during this crisis, with no plan with respect to the return of those jobs. And in response to the COVID-19 pandemic, many have called for the business community to revisit their policies with respect to healthcare, childcare, flexible work schedules, and to lead the charge, if you will, as it relates to access to early childhood education. But I would say that that's not enough. I believe that the business community must do more than advance policies on paper. They must do more to ensure that the workplace is truly inclusive, that inclusion is operationalized in such a way that the impact, the positive impact of the policies on paper can truly be felt by all. That includes a review of performance evaluations. That includes a review, of course, of how leave policies are in fact operationalized and experienced by workers. Further to that point, I think it's important to acknowledge that white collar workers have best been able to transition during this time, and that working class and low income wage workers were and continue to be the most vulnerable for exposure and the hardest hit during this pandemic. And so it is also important that companies, that the business community works to ensure that our most vulnerable workers are protected at work as they return, and that they have access to safe working environments, and also the benefits that allow them to support their families, not only through this crisis, but through recovery. Finally, we need public policy makers to commit to, or recommit, I should say, to rolling up their sleeves to do the tough work, law by law, regulation by regulation, to better understand how public policy is either supporting the advancement and thus the equality of women in the workplace, or serving as a hindrance. Where existing law is perpetuating gender inequality, lawmakers must commit to addressing it. Where we see opportunities for greater supports, lawmakers must be willing to introduce new legislation. So in addition to access to early childcare education, and I say this as the daughter of a mom who was a home daycare provider, ran a home daycare provider service for many years as I was growing up, and ended up founding a system where she supported other women who were home care providers. I certainly understand and appreciate the importance of that work and the role that it plays, but that again is not enough. And extending leave opportunities is not enough. We must be willing to tackle the root causes that have made our progress as women so very fragile. And that includes advancing public policy that seeks to address poverty that so many of our families are experiencing, that seeks to, public policy that seeks to expand healthcare access, including increased access to telehealth services and supports. And we also need to take a closer look at how we might ensure that our landmark historic pay equity legislation in the Commonwealth actually brings about pay equity for women of color, as it brings about pay equity for white women. And the last piece I will share for discussion, thinking about this time and thinking about how so many of us as women are working from home, have made that transition, and are wrestling with not only the family implications of that, but the financial implications of that. We also need to be willing to explore what it looks like to shift some of the tax benefits that corporations experience as a result of the work that they, as a result of their being in business, to families who have had to make the transition to work from home. What can we do to provide more relief for families that have converted bedrooms and storage rooms to offices to help alleviate some of the additional costs that working from home has placed on families across the Commonwealth? With that, I look forward to this conversation today. Thank you.
Wonderful. Thank you so much. You gave us a lot to think about, Tanisha, and to discuss further. All right, with that, I'm going to move on to hear from Leslie Forde. She's the founder of Mom's Hierarchy of Needs. She's also on the Black Economic Council of Massachusetts, a member from Brookline. Leslie, welcome.
Thank you. I am honored and thrilled to be here. I mean, this is a critical discussion, and it's at the heart of the work that I've been doing. What I will add, I think, to the excellent comments that have already been made, is how I think we have these, we have the microcosm of what's happening in the home, and then we have the macro environment of what's happening in our communities and in the workplace. Since the pandemic began, it's now actually been just over a year since I began studying the impact of the pandemic on work and life for primarily women, but for parents and caregivers. So the study now has almost 2,000 parents have participated in the study, 98% of whom are women. And what I'm seeing is that 80% at this point have said that they are doing terribly or not as well as usual as caregivers to themselves. They are giving up everything that used to fuel their mental, physical, and emotional well-being. They are ignoring routine health checks. They are, not pursuing critical care. They're in survival mode, trying to deal with the fact that the amount of housework, childcare, laundry, dishes, you name it, has risen exponentially. And if they are still in the paid workforce, every organization and industry is pivoting, shifting, changing how the work gets done, changing the priorities, and more is being asked from them in the workplace while they have less support at home, less time available. People are waking up hours before their children wake up. They are staying awake until midnight and 1 o'clock in the morning, trying to respond to emails, trying to respond to messages, and trying to cling to their income if they are still in the position to have income. The issues that are intersectional and have come up when asked in the study, what do you need for your well-being right now? What do you need for your productivity right now? And what do you need for your happiness right now? The answers are the same. It's childcare, it's access to mental health care, and it's flexibility at work. And there are policy opportunities, I think, to address some of the systemic barriers for women, as have been beautifully articulated here, and also some of the systemic barriers of racism that are affecting Black and brown women disproportionately. We have women who are being pushed out of the workforce, in addition to the women who are being forced into the impossible choice of having to leave the workforce because they don't have childcare. There are women who are essential workers, and they are in fields where they do not have the flexibility to work from home, or they are being told that they don't have the flexibility to work from home, and they have children who are not independent. There are women who are caring for elderly family members, caring for spouses, caring for people who are ill, recovering themselves from COVID, dealing with family members who've had COVID. All of this is playing out in the community. And because of the gender divide of how labor has happened in the home, most of that work is still falling to women, and it does affect our participation in the paid workforce. But at-will employment, which I think has been an issue in many regards, and how it's expressed is that when women are being pushed out, I've seen in my study, mothers have shared, I asked for time off because my child's daycare closed, or guess what? If anyone has children that are in school or in daycare right now, if there's a COVID exposure, whether their children are sick or not, if their children have a sniffle or a cough, they cannot come to school for 14 days at a time. And absent paid leave, absent the psychological safety to have these conversations with their managers, they are, again, being put into the impossible position of trying to choose between their solvency and the care of their families. So they are getting pushed out in record numbers from the workforce. I've seen people say, hey, I've asked for leave, I was denied. I asked for time off, I was fired. I was laid off. I was shown the door. And so in an era where we don't have severance, in many cases, in the private sector, severance is anemic at best. You have a wealth gap, right? There's a wealth gap for women, and it's an even steeper wealth gap for Black and brown women. So putting some protections in place to mitigate, I think, the downside of at-will employment and allow people to have cushion as they may be forced to transition from the workforce is pretty critical right now. In addition to subsidies for childcare and elder care, subsidies for mental health, and new levels of access to mental health and to healthcare for themselves and for their families. I'll add one other thing in the Black community and in the brown community. particularly among people in my study who are Black and who are of Asian descent, there's rampant concern about racism in the healthcare system, in addition to racism in the workforce. So that mutes our voices, it limits our ability to raise our hands and ask for help during this critical time when everyone is desperate for help and is in need of community support and solutions.
Thank you, Leslie. Thank you very much for that. And I believe there's a question in the chat on your study. So if you have a moment to add in the link, we would really appreciate that.
Absolutely.
All right. And then we have one more speaker to present, Saskia Epstein. She's the Vice President of Client and Community Relations at PNC Bank. And for today's conversation, she is the founding member of the Massachusetts Business Coalition for Early Childhood Education, which has definitely been touched upon. So thank you and welcome.
Yeah. Thank you so much, Emily. And let me say I'm a founding member of the coalition, thankfully not the founding member, and I'll speak to that. It's so wonderful to be here today and to hear from such an extraordinary group of women who are working to solve these challenges for our Commonwealth. I take issue only with one thing that was said, which is Senate President Spilka's remark that there's some irony that today on April Fool's Day is when we're talking about this issue. To sort of bring a little humor and life into this, I think that a lot of us women feel like our lives are a comedy sketch on a good day. And, as my internet unstable button keeps popping up because my children are Zooming to school in the other room and there's construction outside, I feel like in the best possible way, I can laugh at the current situation. But more importantly, on April 1st, we are following the month of Women's History celebration, and in February, Black History. And I think it's really meaningful to continue the conversation around the advancement of women and certainly to address racial disparities and inequalities that we know are not, contained to 1 month, but integrated into experience and touching all parts of our society. I am so pleased to be at a bank that has a longstanding commitment to early childhood. It is what brought me to PNC, actually. I got to know the company while I was leading an early childhood organization. And at a time when there were very few corporate philanthropic organizations investing in that space. So when PNC was sort of growing and expanding in the region, I seized the opportunity to join and lead our philanthropic efforts and external affairs, and very quickly was introduced to other people, thankfully, in our community who were really attentive to this issue, many of whom have long-standing roots as advocates for early childhood education and care. J.D. Chesloff leading the Massachusetts Business Roundtable, namely one of them, who early on enlisted the support of Bob Rivers of Eastern Bank to invest some seed money and social capital to form an early childhood business coalition. It's not the first time in Massachusetts that the business community has mobilized around this issue. But I think timing is everything, and we are seeing a just growing groundswell of attention and care around this issue. And I would say, as many of the other panelists have remarked on, the issues of setting back women in the workforce precede the pandemic, and certainly the Early Childhood Coalition had its sort of formation and founding well before the pandemic as well, because the childcare ecosystem was already in crisis, and childcare access and affordability and quality were really, there was a growing sense of urgency well before we found ourselves in a situation in which we were looking at mass closures and sustainability issues in the sector, and women being faced with impossible choices around childcare options and their ability to attend to the demands of their profession. Currently, John Bernstein, the regional president of PNC, has joined Bob Rivers as co-chair of the coalition alongside Bridget Terry Long, dean of the Harvard School of Ed, and Linda Henry of the Globe, Roger Crandall of Mass Mutual. We have a powerhouse group of leaders from our corporate community representing different corners of the state and industry who are lending their organizational muscle and again, their social capital to this issue. Nearly 80 companies have joined us, representing over 225,000 employees throughout Massachusetts. One of the things that is really striking about that, certainly it's still a drop in the bucket, but we are hearing such common experiences from an employer perspective that really align with what we're hearing from individuals and employees, those still in the workforce and those who have been forced to leave. There oftentimes are different vantage points and perspectives that lift up different stories and issues. And I think what we're seeing right now is some anchoring around the kind of universally felt impact of childcare as an issue that is as deeply affecting individuals as it is employers. So one of the things that I think is interesting is, before the pandemic, we were looking at nationwide as many as sort of 2.7, nearly 3 million children under the age of 6 in need of childcare, but lacking a spot. So, like many other areas of vulnerability in our society, we see that the fragility and inequalities that already existed in the ecosystem, in the childcare ecosystem, were decimated by the pandemic, really too great to bear for many providers, both family care providers and institutions, even with PPP and other relief efforts, which we know did not reach providers in the way that was needed. The result of that is a triple threat. It's driving women out of the workforce, limiting childcare access and affordability, which may return women to the workforce as job losses might be restored. Access and affordability is going to prevent many women from returning into the workforce or returning to open childcare settings, and with extreme detrimental financial repercussions, both to families and businesses alike. We know that the workforce stability for companies like PNC, many of our peers and small businesses alike, the ability to hire and retain talent is lifeblood to our ability to turn a profit. And so we know that as a company, we will suffer. And I think many of our nearly 80 peer companies as members of the coalition agree with that. And we also know that the financial repercussions for families and particularly for women of color are devastating, not just in income disparity, right? And the experience that families are having in the moment now as they struggle to make ends meet, but the losses in accrued income over a lifetime, in wealth generation, in retirement savings. We are looking at a generation that will be affected as it ages, right? And as some of my colleagues pointed out, will affect the generation of children who are facing this pandemic too, not just in the loss of quality early education experiences and a stable and loving care, but also in the financial precarious position that they are facing now and then as adults with aging parents who have fewer resources to continue on in their life. So, it remains to be seen, but there have been estimates of widespread closures. Up to 20% of programs, childcare programs, have not reopened. We know that reopening actually does not guarantee survival. The profit margins, if there are any, are razor thin. The ability to maintain talent in the childcare workforce is an issue that exacerbates an already fragile ecosystem. And circling back to sort of the workforce issue as we stay sort of in our lane as a business coalition and really think about the impact that we can have as companies, we know that 76% of parents have indicated that their quality of work will suffer due to childcare, that nearly 80% are concerned that they'll be unable to work without formal childcare. So the urgency around this issue as large companies and employers are returning employees to their offices, are hopefully returning positions to their payroll, those that have faced layoffs. Those are impediments to the ability to sustain and grow and recover. The coalition's focus is, interestingly enough, not just on advocacy. We heard today from our panelists a lot of really promising legislative sort of calls to action. And thankfully, we have members of the legislature who are deeply dedicated to the issue of women's advancement, of addressing racial disparities, and of focusing on how we can better support the advancement of childcare affordability and access, right, and sustainability of the system. Our coalition is certainly looking to mobilize the reach and social capital of our members around advocacy efforts, and to see a flurry of activity to spur it on, to participate and mobilize as individuals, and as advocates and influential leaders. We're also, looking in our own houses, and I think this is personal for a lot of us, and I would say personal for me too, because when I refer to my own house, I'm thinking literally about my own house and my family dynamic, as well as our own house as a company. So, lifting up the employer practices that will ensure that women in particular, but families with young children, are well supported in the workforce. That is something that we, and all of us who are representative of the business community ought to be able to say that, and say so with conviction, whether or not we lead HR, whether or not we are in the C-suite, we have the ability to influence change from where we sit. To ensure that our workplaces are equitable and attentive to these issues that are affecting the vast, numbers of women leaving the workforce. So the third area that the coalition is focused on, which I think is a really important thing to draw out, is philanthropy. And so, whether that comes in the form of direct charitable contributions and providing private support in a private-public partnership, or driving greater levels of support through corporate philanthropy, through practices that support employees. I think we need to look at how we can amplify the resources, amplify the issue of early childhood, and the way that the business community and individuals in our Commonwealth can support it. So I think the last thing I would just say is that I think with respect to losing ground on some of the things that we've seen great improvements on in recent years, we need to dig back into those systems that we've already put in place to examine issues of workplace equity, inclusivity, and wellness, all of which are aimed at retention and the bottom line. We need to activate male allies, drag them in off the sidelines to jumpstart the conversation. Thankfully, the coalition and the members of our growing coalition represent a deep commitment from some of our city and state's male leaders. But I think, there is something to note about the fact that we have an all-women panel here, and certainly our expert from where we sit professionally and in our personal lives. We need men and women alike to take risks on behalf of what's in everybody's best interests. And we need to double down on the efforts that we've made some headway on, pay equity being one of them. So I'm really eager to hear as we turn this conversation towards solutions. I think there are certainly great ideas in this room among the panelists and in the broader Zoom room, regardless of where you sit. I know that we all have ideas, and I'm excited to be mobilizing around them to gain back the ground that we may have or we may perceive to have lost, and to build a better new normal and better society that attends to the needs of our families and workforce and women. Thank you.
Thank you much. Thank you so much, Saskia, for all of those comments. And we heard you perfectly, so that was great. And also I want to recognize Rep. Gouveia, who also has joined us this morning for this conversation. I have 2 more questions for you, and then I also want to take some questions from the audience. So if people have questions, you can feel free to pop them into the chat, and we can use some of those. Certainly, you have touched upon the many ways the pandemic has shifted the existing challenges women face in the workforce and have brought new ones. What are some upcoming opportunities? And a couple of you have mentioned a few, but what are some upcoming opportunities we have to address, or ways that we can address these issues, whether it be in legislation, on the state or the federal level, funding, or actions available in the private sector? So what are some opportunities? And also, how can we overcome the inevitable opposition? And I'll leave it free. Leslie, I think I saw your hand. And
Sure. I'm happy to start, because something that Saskia said kind of sparked a thought for me, and I'm excited to hear about the Business Coalition, because as I'm working with employers, and I'm in a lot of organizations working with their employee resource groups, or supporting the HR teams around these issues of inclusivity for caregivers, I get the pushback of, well, if we start to subsidize childcare, or if we start to subsidize elder care, is it fair, right, to the rest of our employees? And if we provide these benefits to parents, is it fair? And, and it drives me crazy because, first of all, benefits aren't fair, right? There are people who use the health plan who have chronic illnesses and conditions, and there are people who use the health plan who don't, right? Benefits are not equal, and ideally they're equitable. But I think organizations for years have been, paying indirectly, right, through lost talent, the cost of turnover, the cost of absenteeism, which is billions of dollars a year pre-COVID, right? And that's largely due to childcare, elder care, and other issues. Presenteeism, large costs that are related to mental health care needs among employees. So, I'm encouraging employers, put the money in the bottom line, right? Put it on the P&L, make it a clean transaction, subsidize childcare and elder care, subsidize employees for their remote work expenses at home, increase access and subsidize at very high levels mental health care, because you're paying for it one way or the other. So that is kind of my big ask, I think, to all the leaders who are part of this part of this discussion today. Like, you are going to pay one way or the other, but you can do it in a way that is upfront and a way that is proactive and has long-term benefits for your organization, in addition to the community.
So what I'd like to add to the conversation, and certainly, again, appreciate very much so the importance for us to focus on early childhood education quality, access, and affordability. I didn't share earlier, but the presidency of the NAACP is a volunteer role professionally. I am a member of and a participant in the Business Coalition, the Mass Business Coalition for Early Childhood Education. And so certainly am very supportive of that work and look forward to legislative solutions that will help to advance this issue, as well as private action on the part of companies. But what I want to expand the conversation and make sure that we don't center a conversation about women in the workplace solely around childcare, because we know that that is not the only issue that impacts the ability of women to progress and to advance in the workplace, specifically into leadership roles. And when we think about the impact of the COVID-19 pandemic on women in the workplace, I do think it's important for employers and others to be mindful of the invisibility factor that existed pre-COVID. And, you know, when we think about how women in the workplace have accessed promotional opportunities pre-COVID, and the data speaks to women not necessarily raising our hands for promotional opportunities. We are asked multiple times, and oftentimes those asks come through the informal contacts that have historically, traditionally happened when we are physically in the same space. So here we have a work environment now that is primarily remote for most of us, not for all of us, primarily remote. And so the question becomes, how do we also help to ensure that, you know, while we're trying to mitigate the loss of women in the workplace, that we are also at the same time trying to help ensure that women can continue to progress during this period. And so again, whether we're looking at it, there's certainly the benefit side of this, and I could not agree with you more, Leslie, on your summation. But there's also the supports that HR teams have historically put in place for in-person, you know, when we were in person, that can be so severely lacking during this time period. And so so I'd love for us to be able to put that into the space to talk about. And the other piece, I want to lift up, Leslie, something that you shared in your comments, specifically around push out. In the push out of women, and specifically women of color, the data actually shows that Black women have experienced this at higher rates than any other demographic in our country. The push out that happens, because there is a legislative fix to that. And there are protections that can be put in place to help prevent that from occurring. Again, similar to what we were able to do with pay equity. You know, we can say, you know, just as we now have it, you can't ask about, you know, your current pay, and you can't prohibit employees from talking about their compensation. We can say that, you know, you cannot fire someone for asking about leave, you know, relative to the care for their child. So we can do more there. So for me, again, it's about protecting the role and the presence of women in the workplace, but also during this time, making sure that we're creating space for the advancement of women in the workplace.
I think that's brilliant. Tanisha, I couldn't agree with you more. So
I would like to just respond just a few minutes. Also, I have some other perspectives maybe. You know, I think that we've always had challenges in the workplace for women, you know, dating back from day one, unfortunately. And our goal clearly is to get rid of those barriers for all women. I do note, and it was noted before, that most of the people on even this Zoom event are women, you know, and that I think is still part of the problem. We need to get men to realize that these issues are their issues, their family issues. It's not just women. But so I think, we've mentioned a lot about childcare and the need to rethink how we deliver childcare in Massachusetts. But I'm also in the legislature exploring ideas how we support women, the caretakers of our society at every juncture. Senator Joan Lovely has done a great job on maternal health and working on maternal health, which is so important. And I'd like to give her a shout out for that. But we also need to really focus on women's physical, mental, and public health as well. And with that, the Senate last year passed a major healthcare reform bill that didn't cross the finish line. We are picking it up and we will do it again, learn lessons and make it even better. But what that bill does basically would be to increase access for healthcare, mental health care, increase the workforce at all levels in cultural competency and getting more people involved in the workforce, truly work towards parity of physical and mental health, which is so important, and reduce the stigma of mental health, which is also critical. Telehealth has made a big difference for mental health services for all residents of Massachusetts. That has been a priority of the Senate for many years, and I'm glad that it was included in our last session's healthcare reform bill. More and more people are not only making mental health appointments, but keeping them as well, particularly women. It's easier during COVID and beyond. Quality early education, K-12 education can ensure working parents can feel less anxiety about their children. And we need to ensure that we fund the Student Opportunity Act to keep that going. We need training. So many of these jobs may not come back, or they'll be different, or women will not be able to return. So we really need to invest in training and retraining for women who have either left the workforce or pared down. And we need to ensure that they come back strong. Part of that is Voc Tech schools and certification schools, but also community colleges. Years ago, I started a program called Training Resources and Internship Network called the TRAIN program as part of community colleges across Massachusetts. They do a lot of healthcare programs, and particularly women have entered that, gotten degrees and gone on to healthcare. We need to invest in more programs like that. We need to also create a robust culture of mentoring of women. That's so critically important. In addition to policies, the pay equity, I'm proud to have been one of the chief sponsors with Senator Pat Jalen on the Senate for pay equity, paid family and medical leave. I was filing that bill for over 10, 12 years. It's a slow process sometimes, but it can happen. Getting more women in all levels of business, state government, from all different levels, and using mentors to help and role models to help. And we also need stronger supports for elder care so the burdens don't fall disproportionately on women. And this must be done with equity in mind so that every sector of the economy, every region of the state benefits, so that we really understand. And I look forward to working with all of you, not only the panelists here, which I congratulate all of you, but all of the folks that are on here now and may be listening, because it's only then can government truly create policies that actually help people in really concrete and sustainable ways. So, and that's just to end one of the major reasons why I created the new Senate Committee on Reimagining Massachusetts, to look forward to how we want to come back to better. And we created the Committee on Racial Equity, Civil Rights, and Inclusion so that we ensure we look at all of our past and current and future policies through an equity lens.
So President Spilka, I do want to thank you for your leadership on the Hill. You and I have, we've known each other now, I think, for a couple of years. And I do want to just say publicly, it has, I have been encouraged by how you have looked at these issues and how, as you ended, you are, really trying to bring an equity lens to the work. And so I am hopeful, specifically going back to your references to healthcare, that is, a space where we will see some success in this session, because when we talk about root causes, access to quality healthcare, in particular the mental health supports, I think are going to be foundational to us being able to build back better. So again, thank you for your work.
Thank you.
Great. And Saskia, if you wanted to make one more comment on this, and I have a couple of questions.
Yeah, I thank you so much. First of all, thank you, all three of you, for your thoughts, for your leadership. Tanisha, thank you for sharing that you're a member of the Business Coalition and reminding us that as the president of the NAACP, you are a volunteer. I think that's indicative of what a lot of women do in taking on a burden of responsibility to create change. And I would note the comments in the chat about the number of women in this room. I think that I'd like to sort of turn back to a couple of things. Leslie and Tanisha both were very deliberate in the language that they were using in talking about women being pushed out of the workforce. I have heard others on occasion, and certainly in print, refer to women dropping out of the workforce. I think now is a time in which language and visibility of these issues and data are of critical importance. And the data piece is something that I think back to the advancements around pay equity, right? Really helped to mobilize our community, both on the employer side, in legislation, and in individuals who, are working to better advocate for their compensation. I had the privilege of being a volunteer trainer for the City of Boston's Pay Equity Project. And I will say, there was always a moment in workshops, they're voluntary, and we had a wonderfully diverse group of women of all ages and all stages of their careers come to, learn to be better negotiators for their salary. And there was always a moment in the room where there was a shift. And it was, to me, it was a shift toward, certainty that the women in the room were no longer going to make the sacrifice. And that shift often came about when we looked at the cumulative financial loss over the lifetime, when it was a house that you would not be able to buy because of how you negotiated in one entry point to a job. When that initiative first launched, my first response to it was enthusiasm and a question mark as to why we were training women to be better advocates versus training employers and hiring managers to hire with more fair pay practices and equitable practices. And I think similarly, we're in a position in which, to really be effective, certainly we need to mobilize people who are affected here and disproportionately women, but to enlist those who are making decisions, who have the ability to influence employer practices around wellness or mental health or childcare, the host of issues. The intersectionality of all of these issues that are creating this immense burden on women is complicated. It makes it difficult to navigate, but it also presents an opportunity, because everywhere we look and everything that we touch is an opportunity to create change and positive momentum to affect the lives of women, and certainly in the workforce. You know, I work at a bank, so we spend a lot of time looking at numbers. I've seen recently some leaning into technology and tools and data that help to illuminate and advance these issues. For instance, at a recent pensions conference, there was discussion of an interactive calculator that could help women plan for a break from the workforce, whether that's you know, planned break to care for an elder or childcare, and how that will affect their long-term retirement savings, which particularly young people often are not thinking about or able to make a consideration around. The calculator showed some stunning results, similar to sort of the pay equity gap and the cumulative effect of that on a lifetime of earnings. A 29-year-old woman earning $44,000 who took a 2-year leave from the workforce, voluntary or involuntary, to care for a child or elder, would forego a total of over $300,000 in lost wages, wage growth, and retirement assets over the entire lifespan. You know, when we have information like that, both in terms of providing and supporting individuals and the choices that they're making, and also informing employers. So the loss of employees, right? The cost of turnover, which affects the bottom line. Those data points are really essential, and we have to find ways to integrate that information into our practices and be really data driven. The data tells a indisputable, compelling story. You know, as Leslie put it, we pay now or we pay later. The truth is everyone pays, right? We spend a lot of time arguing over whose responsibility it is to pay. Everyone pays. And if we invest on the front end of this, right, on our hiring practices being more equitable, on workplace benefits and, you know, practices in the workplace that support women's advancement, as Tanisha reminded us, is of critical importance. You know, childcare, you name it, all of those areas can be things that are attended to. And the nature of the fact that these are so intersectional gives us an opportunity to make change in small ways, no matter where you sit as an individual and the level of professional responsibility, or whether you've signed up to be personally responsible as a volunteer. We all have the ability to influence these changes.
Great, thank you. And to really jump off of that, there have been a lot of questions about this changing workforce and these benefits, and what companies and organizations should be thinking about, particularly around flexibility. So Tanisha, one thing that we were talking about this week was certainly there's been a lot of advancements in technology and sort of being able to have working from home and other sort of unforeseen benefits of this past year that we hope to keep. However, I think one question has been brought up around the flexibility piece, true flexibility. So, you know, one question was a little bit of a worry that what is this look like moving forward? You know, is this 24-hour workday? You know, is this women trying to work at 5 a.m. and midnight and weekends to catch up? Or, you know, so what are the ways to avoid sort of this new normal of flexibility so it doesn't go sort of swing the other way? Does this require a policy solution, or is it about changing the way we do business? Leslie, I'm not sure if you would like to tackle that one.
I'm happy to jump in on that one. So in terms of the way we do business and the way work works, I think that has been broken for, you know, that's been broken for a really long time. Even though we're in the post-industrial era and we're not working in factories making widgets largely, although some people are, that's not the bulk of our economy anymore. We still have this on-call culture, right? So we ask for permission to go to a doctor's appointment, or ask for permission to be away from our computers for a couple of hours, instead of like flipping it so that, you know, work structures synchronous time in manageable bursts of synchronous time. We do not need to be tied to the computer to be on call, right? People are constantly spending, I'm seeing this in the study, like people are spending all of their working hours or daytime hours answering emails and being in Zoom meetings and then doing their actual work product and output at night. So I think rethinking how meetings happen, how many meetings happen, when people have to be available, you know, like why not say, hey, let's just all be in kind of synchronous availability between the hours of, you know, 1 and 2 or 1 and 3, and the rest of the time people actually have, whether they're caregivers or not, space for deep work, space to take a walk, space to take a nap, right? I mean, these are just things that are not part of our work culture anymore. Also, flexible expectations in this pandemic, this has come up again and again. You know, people are being asked to do the same work or more work with less resources. I can't tell you how many women in the study have said, you know, they cut my department in half, but I have the same performance review criteria. Or they've furloughed most of our department, but the rest of us who are left, have to deliver the same amount of work. You know, expectations can't be the same when resources are less. And I'll add just one more thing, because this speaks to Tanisha's point and I think Saskia's point as well. Like there's all these hidden rules in the culture of work. And I mean, I've had managers tell me, I had a manager tell me it wasn't that long ago, his idea of leadership was being the first in and the last to leave. Right? This is while my youngest is now in kindergarten. At the time, she was a toddler. But I mean, this was pretty much telling me that I couldn't be in leadership. And I was on his leadership team by saying you have to be the first in and last to leave. So a lot of that dated thinking about what leadership looks like and what flexibility looks like, I think is really critical to shifting the norm so people aren't pushed out of work. And it's women who are typically being pushed out of work.
I agree with that. I saw the comment in the chat, and I do want to expand it a little bit though, you know, and I'm speaking now as someone who I didn't think I had more time in my day or in my week pre-March 2020. And what I have found for the last year, true confessions, is, you know, I am not only working longer hours in front of this thing, but I'm also working 7 days a week. In fact, it is an exception when I'm not it's just a continuous, it's just, time is just continuing, okay? And so I do think we need to be concerned about it as we talk about flexible work schedules. I do think we need to be concerned about the 24 hours a day, the 7 days a week. We've got to figure out how to, you know, from a cultural standpoint, if possible, really build in some guardrails around what this should look like. Because if we do not, the cost to that is going to be from a health standpoint for all of us. And so you know, my fear though, you know, 20 plus years in corporate America is that, you know, while I would love for us to be able to, as an industry, as a sector, set our own guardrails, my fear is that absent an intervention, I'm not sure that the private sector will be able to set its own guardrails. But I do think we are in danger of not knowing when to stop, and continuing this cycle of guilt that may come with needing to rest, needing to step away for whatever reason. I don't have a solution on that, but I do want to affirm the comment because I do think it is a real concern that we need to wrestle with.
All right. Well, thank you so much for that. And all things for us to flag and work on and continue to bring others into the conversation, especially our male counterparts. So thank you. There's a couple of more questions on childcare, and so I didn't want to leave it. So Chris Van, is it Burskirk from the State House News Service, Senator Spilka, he had a question about advancing early education, rethinking how it's funded. Are there any specific bills or policies you're looking at this session? So that's just something we wanted to ask you specifically. Oh, I'm gonna try to unmute you. There you are.
Thanks. Thanks. I think we have to be looking at all aspects of early education and care. There are quite a number of bills that have been filed about it. And I do want to mention that the Senate Special Committee on Reimagining Massachusetts Post-Pandemic Resiliency, led in the Senate by Senator Adam Hines, will be having a listening session on education and childcare to be held on April 14th. It will, of course, be via Zoom, but it will be open to the public, and people can participate, just come in and listen. We want, definitely, we want feedback, and we will be looking at all of the bills. I think we really do need to, we have an obligation and a responsibility to rethink the way we deliver early education and care, with the goal of making it accessible, affordable to all young children, but to also make it, find out what are the true needs of working parent or parents. Is it location that we need to be more spread out about? Is it the hours that we need? Again, most people, I know many of us work almost 24 hours unless we're sleeping. And I think that that is a problem. Talk about mental health. But if I am working at home remotely and I'm, instead of working from 9 to 5, where I used to go into the office, I'm working from 12 to 9 maybe, or different hours. Do we need different hours? And in which case we need to figure out a way to support our early education and care and childcare centers to be more responsive to the changing needs. So I think we need to hear from people. Right now, childcare centers are paid on a per child basis. So if you have 20 children, whatever, then you get paid for 20 children per head, so to speak. And that may not be the way to go forward, because during the pandemic, we learned, as we have all here noted, many childcare centers closed down, and many may not reopen. But we need to ensure that we have not only sufficient childcare, early ed and childcare, but quality early ed and childcare, and accessible. So we may need to be paying more by classroom or by school, or I'm not certain, but I think we need to be looking at all of these issues and be open to change. I think Massachusetts has a great opportunity here. We're not going to go back to the old normal, and we should not go back to the old normal, but we have an opportunity and a responsibility to be looking at things with a different lens. Everything, to be honest with you. At times it seems overwhelming, whether it be healthcare, education, childcare, transportation, work, space. If people aren't returning to some of their downtown areas for work, again, maybe we need to look at the way we lease the space, and maybe we need childcare closer to where people are working remotely. So, it's sort of open-ended, and I'm very open to the possibilities, which is very exciting.
Thank you for that. All right, so we have a couple of minutes left of a conversation that's probably hours long. So Saskia, for our sort of your closing minute here, what is our call to action? How can we move this work forward in our respective fields? You know, what are some last things that you can leave us with so that we can move this forward from today?
Well, I can share what I'm going to personally adopt as action. I think inspired by Tanisha's candor about how her work life has expanded with the relative flexibility of, always being at work. I think the truth in that is something that a lot of women, and certainly I have masked, in my own life. So I'm going to, show up and have more candid conversations. And I think my call to action would be to invite all of the 100+ women in the room to take some measured risk, whether it's in the response that we have to somebody asking how we are and where we're saying great, or talking about the arrival of spring or optimism about the vaccine or what have you, but to pull back the curtains a little bit on the hardship that we are experiencing and that we see others in our personal lives, in our family lives, right? In the survey that Leslie talked about, those experiences are really meaningful, and that sort of storytelling and truth telling is very powerful. I think we bear the burden of responsibility ourselves, perhaps, for our own choices, and yet we are part of an overall system, right? And are sort of led to put in the hours, if that might be the example, or what have you, in part because we're influenced by the culture and the expectations and the demands around us. And so let's share the burden of responsibility. Let's have those difficult conversations with others, whether they're peers in the workplace, right, or managers, or spouses. Let's pull in other people off the sidelines, men especially. I told my husband I'd put him on blast today because last night I asked him, what he thought about this issue, and he kind of gave me a shrug. And he is a enlightened male social worker who took paternity leave when we had our children, and first met me when I was his boss. So he's an active feminist. I said to him, if we can't get you to take action, we're in trouble. Let's pull the people in our lives who might be either quietly suffering or not taking the power and influence that they have to create change. Let's pull them off the sidelines, right? And speak truth and, let both optimism and worry drive us forward.
Great, thank you. Karen, or Tanisha, I'm sorry, would you like to make last comments?
Sure, thank you. Again, thank you for including me in this conversation. This has been great. I have two. One, yes, this is predominantly a space that is predominantly comprised of women, but I love it. It would be great to have more men, but we are more than enough. And so I want to just remind us that, as women, our existence is a superpower, but we're not superhuman. And so allowing ourselves permission and embracing some vulnerability and in our humanity, I actually think lends itself to even more power. Okay, so that's one. The second is, as we start to think about, moving forward in this space, I really want to build on something that President Spilka shared about governance. I think it is critically important for each of us, regardless of where we sit, regardless of what our role is, to take a more active role in the process of governing. And to really become more intentional about partnering with our policymakers to help inform the policy that will hopefully become law, so that it is intentionally designed to help ensure that all of us can thrive. That I believe will go a long way to help ensure that Massachusetts does indeed make it through this pandemic, and that we make it through this pandemic stronger than what we were before.
Great, thank you. Leslie, last comment.
Sure. Yeah, so I think on the employer side, and it has come up in different ways here, but for all the leaders who are part of this discussion, you know, giving people more space, less synchronous time at work, shorter meetings, lack of meetings, encourage people to take time and space for self-care and consider subsidizing elder care, child care, and the costs of working from home so that people can manage through this kind of extreme time in an entirely different way. I think at the policy level, we talked about a lot of great issues and topics. One that we didn't touch on a lot was care workers. And I've spent a lot of time on that issue in a past life when I worked in the care industry. But you know, care workers are often in the shadows. They're often Black and brown women. They're often not able to participate in any of the protections that the professional workforce has. So rethinking policy that also supports them and allows them to participate in the workforce and have the ability to care for their own families. And then I guess the last is for all of you, just self-care. You know, and it's Tanisha said it so beautifully, and Saskia as well. Like, we are, most of us, and especially for all the women here, we are working 7 days a week. We are working around the clock. We are working before our kids get up, and we are working long after they go to bed. If we are caregivers, but it's draining, and success and burnout are not positively correlated. I try to tell employers this all the time when I talk with parent groups, like, it is better to take that walk, to take a break, to splash some cold water on your face, close the bathroom door if you need to close the bathroom door, and take 5 minutes to yourself. This is an endurance race, right? Like, we all have to endure to make the changes that we're talking about today.
And Senator Spilka, last comment.
I just want to lift up and echo the issue of each person's mental and physical health. I do this all the time with my colleagues in the Senate, reminding them of the demanding jobs that they have that are mostly 24/7. And we all need to plan time for ourselves. Otherwise, the days, weeks just get taken away from us. And so I just remind people, spring is here. Summer is coming. It's been a really tough year for each one of us, for our families, for our coworkers. Be kind to each other. Be kind, though, to yourself as well. And take that time off. Plan it. Otherwise, it's just gone. But definitely take that time.
Thank you so much, ladies. Thank you so much. And we're going to have our Deputy Director, also another woman leader at MAPC that we all look up to and I know works 7 days a week. I'll pass it to Rebecca Davis for a closing comment. Thank you again.
Well, thank you, Emily, and thank you, Saskia, Tanisha, Leslie, and Senate President Spilka. You know, it was so wonderful to hear from these women leaders today and to be with all of you. And, you know, I'm taking away from this, you know, to continue to show up truly and authentically, and how much we need women in leadership roles to bring that authenticity and that point of view into whether it's HR or employer relations, but also these larger public policy conversations. And I'm especially grateful for Senator President Spilka, and knowing that she brings that perspective and role into public policy making, I think truly means we have a brighter future ahead of us. So it's a moment of transition. It's a moment of opportunity. And I hope we all can come up and think, you know, how in our own lives, in our own companies, municipalities, can we bring some of these lessons to bear and make sure that we are working for a brighter future. We're thinking about some of these systemic changes that we need, as well as these smaller changes that we can all take in our own lives to create the space that we need, you know, to really continue being the great leaders we are. And I know that I am surrounded by an amazing team at MAPC, an amazing team of female leaders. I see many of my female directors on the phone, as well as an amazing team of leadership in the municipalities that we get to work with. And I'm just looking forward to this opportunity to think about how can we make our lives more sustainable and our Commonwealth more equitable moving forward. So this is just the start of a long conversation, but thank you all for coming today.
Thank you.